Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about Chédiak-Higashi syndrome. Chédiak-Higashi syndrome is a rare autosomal recessive disorder caused by lysosomal trafficking regulator gene mutations, leading to oculocutaneous albinism, immune dysfunction, and neurologic abnormalities. It was initially described by César in 1943. Chédiak in 1952 and Higashi in 1954 then discovered the maldistribution of myeloperoxidases in the granules of the neutrophils in affected patients. Chédiak-Higashi syndrome is with an estimated incidence of less than 1 in 1 million live births worldwide. There is no race predilection, and all age and ethnic groups can be affected. However, the onset of the disease is typically after birth and under the age of 5. The underlying genetic defect is a mutation in the lysosomal trafficking regulator gene. This gene is located on the long arm of chromosome 1, and is responsible for the regulation of lysosomal trafficking and the synthesis, fusion, and transport of cytoplasmic granules. The mutation of the lysosomal trafficking regulator gene disrupts the protein synthesis and affects the storage and secretory functions of lysosomal granules of leukocytes, fibroblasts, dense bodies of platelets, azurophilic granules of neutrophils, and melanosomes of melanocytes. The defects result in enlarged vesicles and non-functional lysosomes. Around 40 different mutations have been discovered, including nonsense and missense mutations and deletions and insertions. Patients with Chédiak-Higashi syndrome exhibit immune dysfunction, pigmentation abnormalities, platelet dysfunction, neurologic involvement, or may develop to accelerated phase. The prognosis is determined by primary immunological lymphoproliferative histiocytosis, known as the accelerated phase. An early onset accelerated phase usually results in a severe manifestation and death in the first decade, while 10 to 15% of patients with late onset and less severe manifestations survive without bone marrow transplantation. Death usually occurs due to bacterial infections and complications of hemophagocytic lymphohistiocytosis, which occurs in 50 to 80% of cases. Patients with Chédiak-Higashi syndrome also develop hemophagocytic lymphohistiocytosis infiltration of different organs leading to fever, splenomegaly, hepatomegaly and bleeding. Hemophagocytic lymphohistiocytosis is associated with excessive lymphocyte and macrophages responses and is the leading cause of death in Chédiak-Higashi syndrome patients. Patients with Chédiak-Higashi syndrome also exhibit increased susceptibility to aggressive malignancies, notably lymphoproliferative disorders. Diagnosis involves clinical signs, identifying enlarged lysosomes and lysosome-related organelles in various cell types, including myeloid cells and melanocytes, and genetic testing and detection of mutations in the lysosomal trafficking regulator gene. On cytology, large fused granules can be seen mainly in the granulocytes, monocytes, and lymphocytes, but also can be noted in the fibroblasts, Schwann cells, astrocytes, melanocytes, and hematopoietic cells. These granules are made up of an abnormal fusion between the primary and the secondary granules. Peripheral blood smear from a patient with Chédiak-Higashi syndrome showing multiple large azurophilic granules characteristic of this disorder, in the cytoplasm of a neutrophil and a band form. Peripheral blood smear from a Chédiak-Higashi syndrome patient showing abnormally large intracytoplasmic granules in 2 eosinophils. Lymphocytes from a Chédiak-Higashi syndrome patient with large azure granule. Monocyte from a Chédiak-Higashi syndrome patient with large azure granule. Hematopoietic stem cell transplantation is the treatment of choice for Chédiak-Higashi syndrome patients. Following hematopoietic stem cell transplantation, the 5 years overall survival is around 50%. Nevertheless, most of patients suffering Chédiak-Higashi syndrome die from recurrent infection. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.